The big question is, why are diabetics at risk of liver disease? And how can this be prevented or minimized? A common myth is that only heavy drinkers get liver disease. This couldn't be farther from the truth, because this statement overlooks the impact of non-alcoholic fatty liver disease, which is particularly prevalent among those with type 2 diabetes. Non-alcoholic fatty liver affects millions worldwide, with a significant proportion of those being diabetics. But why is that? It's because the risk is increased due to insulin resistance and high blood sugar levels. Did you know that fat starts to accumulate in the liver? And that's not all. This condition can even progress to more severe liver diseases like non-alcoholic steatohepatitis, also known as NASH, cirrhosis, and liver cancer. So what does all this mean? Well, it means that liver disease is a critical concern for diabetics. Let's dive deep into the meat of this video. Now, what is the impact of diabetes on the liver? To answer that, you have to first give us a big like. Now we have to establish that diabetes, especially type 2 diabetes, can have profound and multifaceted effects on the liver, potentially leading to a range of liver conditions. Let's dive a little deeper to understand what this all means. 1. What non-alcoholic fatty liver disease, NAFLD, entails is insulin resistance, which is a hallmark of type 2 diabetes. It causes the liver to store excess fat. High blood sugar levels contribute to the deposition of fat in liver cells called hepatocytes. In the beginning, fat accumulates in the liver without causing significant damage. But over time, fat accumulation leads to liver inflammation and damage. This can progress to fibrosis, also known as scarring of the liver tissue. Okay, next is cirrhosis. This occurs with ongoing inflammation and the buildup of scar tissue or fibrosis. Soon the liver structure becomes increasingly scarred, leading to cirrhosis. Cirrhosis impairs liver function and increases the risk of liver failure and hepatocellular carcinoma, or in other words, liver cancer. Okay, number 2 is insulin resistance and hyperinsulinemia. It's important to note that insulin resistance leads to elevated levels of insulin and glucose in the blood. That being said, the liver plays a central role in glucose metabolism, and chronic high levels of insulin and glucose stress the liver. How does this process impact your liver? Well, let's just say that insulin resistance promotes the synthesis of fatty acids in the liver, increasing fat accumulation. On to our third point with liver inflammation and fibrosis. Now, chronic hyperglycemia, or high blood sugar, and hyperinsulinemia, which is high insulin levels, cause oxidative stress and inflammation in the liver. Now, we all know by now that couldn't be good. But how does this impact the liver? Well, oxidative stress, also known as reactive oxygen species, ROS, happens during high glucose metabolism and damages liver cells, causing an inflammatory response and releasing cytokines, thus leading to liver cell injury and promoting fibrosis or scarring. Now, number 4 isn't talked about enough, and it's hepatocellular carcinoma, also known as liver cancer. Cancer can occur with persistent liver inflammation and fibrosis, which leads to an increased risk of cellular mutations and cancer development. Next on our list is glycogen storage. This mechanism occurs with poor blood glucose control in diabetes, and it can result in the liver storing excessive glycogen. This is basically a stored form of glucose. Clinically, this manifests as hepatomegaly, which is a fancy way of saying an enlarged liver. Excessive glycogen storage can cause the liver to enlarge, and abnormal liver function tests can complicate diabetes management. The 6th point is hepatitis C co-infection. Did you know that diabetic patients have a higher prevalence of hepatitis C virus, HCV infection? Hepatitis C virus can worsen liver health and increase insulin resistance. The combination of diabetes and HCV accelerates liver disease progression, leading to cirrhosis and liver failure more quickly. Managing both conditions simultaneously can be challenging and requires comprehensive medical care. As promised, we will cover some of the treatment and management options that you can discuss with your healthcare provider. Managing liver health in diabetic patients requires a multifaceted approach. Without further ado, let's dive in. First, blood sugar control. The mission here is to reduce the risk of liver fat accumulation and inflammation. This can be done by using medications as prescribed, monitoring blood glucose levels regularly, and adhering to a diabetic-friendly diet. Blood testing can provide a long-term overview of blood sugar control. Next, a healthy diet. Following a balanced diet full of antioxidants helps to promote liver health and overall well-being. Incorporate plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid high sugar, high fat, and highly processed foods. These best practices help to maintain a healthy weight. We all know that regular physical activity is beneficial. The goal here is to improve insulin sensitivity and support weight management. Engage in at least 150 minutes of moderate intensity exercise per week, such as walking, cycling, or swimming. Include strength training exercises to build muscle mass, which improves glucose metabolism. This also helps to reduce liver fat and inflammation. Seek medical advice for weight loss strategies, including possible pharmacological treatments or bariatric surgery if needed. Next, limit alcohol consumption. We can't stress this enough, and it's a frequent topic here on our channel because it's just that important. The goal is to reduce additional liver stress and prevent further liver damage. Limit alcohol intake to moderate levels, up to 1 drink per day for women and up to 2 drinks per day for men, or avoid it altogether, especially if liver disease is present. Finally, regular medical checkups. The goal here is to monitor liver function and detect any liver abnormalities early. Your doctor might use imaging studies such as ultrasound, Connecticut scan, or MRI if necessary. And don't forget your vaccinations. The goal is to protect you against hepatitis B and A, which can worsen your liver health.